Get breaking news, updates, and the best of talk.
Women have to work twice, even thrice as hard for them to get things that just come so naturally to a lot of men who feel that leadership is their right.
You were in prisons for how many years?
For 6 years, 8 months.
Were you going to court from prisons then?
Yes, but before I started court, it took me 2 years.
Just being in prison?
Yes.
Without your case even start at all?
Confinement.
You were there?
Yeah.
Here on your number one station for talk, 99.3 Nigeria Info. Let's talk.
How clean or safe is the water you have been drinking in the last couple of weeks? How clean and safe is the food you have been eating? Have you been cooking yourself? Or you've been going to public places to buy food to eat? What's the role of schools, associations, churches, mosques, and you, Lagosians? What's your role in our fight to combat this deadly ailment, cholera, which has bedeviled the state in the last couple of weeks? Not just Lagos, but of course across the country. But it does feel like Lagos is the epicenter. Well, that will get us talking throughout today on the newsroom, as I bid you welcome to another edition of the show on 99.3 Nigeria Info, your number one talk station. If today is the very first time you are tuning in, well, the newsroom is a production of Nigeria Info's Newsroom, where we take a critical look at some of the big stories that have made the rounds in the course of the last 7 days. My name is Ufuoma Egbamuno. It's a pleasure to be here once again. The last 2 weeks, we have not been able to do this program because of our live coverage of Euro 2024. I don't know if it is midlife crisis or if I am getting a little too old, but the way I used to be so enthusiastic and so crazy about football or tournaments, I'm not sure I have that same enthusiasm. I still watch the games, but anyway, that's the story for another day. Just to let you know why we've been able to do the show in the last 2 weeks. But at 15 minutes gone past the 6 o'clock hour, every Monday, we take a critical look at some of the big stories that have made the rounds, in the course of the previous 7 days. Today, there's nothing bigger than, of course, cholera, which has been bedeviling the country, especially right here in Lagos. You just heard on the news that we've recorded about 29 deaths. Not good enough. Absolutely not good enough. I was talking to a couple of friends and former colleagues a couple of days ago, and I'm not sure anytime soon I've heard any first world country have issues like cholera as a problem. And a friend of mine said the fact that in 2024 we're still dealing with issues like cholera just shows how farther we are from, where we ought to be as a nation. But that's a story for another day. Let me just run through some of the big stories that have made the rounds, even as we're going to be talking to a public health professional on the show today. Just get a feel of what we should be doing. Also, there was a press conference held today. We'll tell you about that. It had to do with cholera. And of course, the Lagos State government's plan to combat this deadly ailment that has claimed 29 lives. So a total number of 194,897 deaths have been recorded from the outbreak of cholera worldwide. We brought you the report last week that has threatened a prolonged strike action if President Tinubu does not pay the lecturers. And we saw the president and Peter Obi clash over a planned purchase of new aircraft for the presidential fleets. The less I say about that, I guess the better. Because if I say honestly what's on my mind about that, probably will get a letter from the Nigerian Broadcasting commission. Yeah, I probably will get a letter if I honestly say what's on my mind, about this planned purchase. Anyway, let's move on. The federal government has set aside the reinstatement of the Emir of Kano, Mohammed Sanusi II, even though the Kano state government has had their own interpretations about that. Very, very, I don't want to say funny, but these things happen in Nigeria. Also, one of the big stories from last week was NAFDAC denying, lifting the ban on the sale of alcoholic beverages in sachets. And of course, the very weird story from the NDLE busting a shrine guarded by a big black snake. And of course, discovering loads and loads of illicit drugs in that shrine somewhere in Benin City. Okay, I just looked at the screen in front of me and I thought I was going to see someone else, but I saw someone else. Anyway, I do have a guest on the show today, like I did tell you, a public health specialist and a medical officer of health in Ifelodun LCDA, and that place is quite dear to me. I have emotional attachment to that LCDA or that local government because I was born there. But Dr. Japhet Olugbogi is on the show this evening. Doctor, a very good evening to you and welcome to the newsroom this evening.
Very good evening to you as well. Hope you have not been bothered by the rain. It's raining all day.
Well, we already know that it's the season, so we find ways to live our lives, or lead our lives rather, with the rains. I'll rather the rains than the sun, to be honest.
That's good.
Okay, so over the last couple of weeks, it's not been particularly great for Nigeria as a country, and especially for us here in Lagos as a result of this cholera outbreak. For the benefit of someone who's listening to the show right now and possibly has no idea the cause or causes of I almost said malaria. Sorry, cholera. Could you kindly explain to us what results or what we do that ensures that we have cholera?
Yeah, thank you very much for having me on the show once again. Cholera is a diarrheal disease that is caused by the ingestion or consumption of contaminated food or water by people. And cholera can occur in everyone, adults, children, pregnant women, anyone at all that takes in something that is contaminated by the bacteria causing cholera. Now, you will wonder why we are having cholera at this time. It is because it is the rainy season. What does rain have to do with cholera? What happens during rainy season is that rain and flood washes sewage, fecal matter. Fecal matter now in this case is poop. Washes everything into homes, into communities, floods communities, flood streets, contaminate the source of drinking water, the source of food items stored, food items displayed, cups, utensils, plates, all sorts of things that people use to eat, all sorts of things that people consume. This is the cause of cholera. Now, the reason why it's worse in rainy season is because the cholera bacteria is always inside the matter or sewage or refuse, or in the poop of someone that is infected, like already infected. During the dry season, almost everything is where you leave them in terms of on the ground or the soil. But during rainy season, when people put on ordinary ground or inside plastic nylon and throw them away, when people carry refuse and just dump in front of the house or by the roadside, the rain washes them away from the place you put them or the place that you put and wash them into where people are, where people eat, in the market. So the bacteria inside the refuse, inside the food, go and contaminate well water or boreholes that are not well strong, or streams or ponds or lakes and all that. And, you know, a lot of people, especially in Lagos, who do not have a very reliable source of drinking water.
True.
We just take any water and drink. We just take any water and use to prepare their food. They just take any water and use to wash their vegetables and fruits. They just take any water and use to prepare some beverages that people take, like Zobo, Tiger Nut, and what have you. So, because of this, it is commoner during the rainy season. But it is a disease. I have had a disease of poor sanitary habit, poor sanitary practice, poor sanitation. That is what cholera is.
So you've just pointed out that this is something that usually happens during the raining season. I know that cholera outbreak, it feels like a yearly thing in Nigeria, but did we have it this bad sometime last year? 'Cause I don't know if my memory is.
There was a cholera outbreak last year, and as we are doing now, I was also on radio and TV. At that point in time as well, to educate the Nigerian citizens on it. Now, what we can say is that last year we probably didn't have so many people die as we are doing now.
Yeah.
But we had an outbreak of cholera last year as well. Now, we are just having now outbreak from like early part of June. Let's say I think we recorded the first case on June 10 or 11 in Lagos. But so many parts of the country have been recording cholera outbreaks since January this year.
Wow.
We've been having cholera outbreaks since January in so many parts of the country. It's just like it's at the peak of the rainy season now that Lagos is having its own share of the ordeal. But the cholera outbreak has been part of us. Now, I heard earlier when you were talking about developed countries not having cholera and all that. Yes, these countries are industrialized countries, highly industrialized countries with very good sewage treatment, very good water treatment, very good water supply, urbanization, good housing, and all that. And their people, their populace also are also educated. They practice,
safe hygiene,
personal hygiene. And their country has their laws in place, and the laws are always and almost always enforced. These are the challenges we have in Nigeria. These are the challenges we have in so many other parts of the world where there's cholera outbreak right now. We don't have water. We don't have potable water. Not everybody has access to potable water in Nigeria.
True.
We have access to good housing in Nigeria. Not everybody has access to toilet in Nigeria. This is why people are practicing open defecation. Mainly because we don't have toilet facilities. Of course, although there are some people who have toilet facilities that still practice this open defecation, the major reason is because we don't have enough or adequate toilet facilities. The people who have toilet facilities and practice open defecation still is because of year-long or so many years of practice of open defecation that they feel that it is even a normal thing for them to do. And those who don't want to practice open defecation probably don't even have water to flush their toilet. When there's no water to flush toilets, people do not want to use the toilet. How many toilets do we have in our public places? How many toilets do we have in the market? How many toilets do we have in places where people use, people, frequent like that? So we don't have enough toilet facilities, and when we have, we don't have water to flush them. We have also pointed out that even in government facilities, you enter some offices, you want to urinate, you cannot do that because the toilets are under lock and key.
True.
And that's because there is inadequate supply of water.
Just to also add, Doctor. So sorry to cut you there. Just to also add, I think part of the conversations we're having here is also to educate the listener. Even in public places where you have water, some of us Nigerians, have made it a terrible habit that we use these public toilets and we don't flush. The other day, I was Go ahead.
Some people have done this over the years that they don't even recognize that there's water anymore. They just want to pool and leave the pool wherever they pool the nature. It's a habit that's been with them, and it's bad practice. It's a terrible practice. It's one of the major reasons why we still have cholera in our country and some other infectious diseases. It's because we do all these bad practices. I am sorry to say, but many Nigerians are getting people that we do not take care of our own sanitation.
I wouldn't disagree. Lagos, if you just joined us, this is the newsroom, and we're talking cholera and, of course, the outbreak and the impact it's had here in Lagos and, of course, across the country. Lagos has recorded about 29 deaths already. And joining us on the show today is a public health specialist, a medical officer of health of Ifelodun, LCDA, Dr. Japhet Olugbogi. Doctor, this could be a controversial question because loads and loads of Lagosians still practice this. But how safe is it to patronize street food at this time?
Oh, very, very wonderful question. Now, cholera has its origin in the sea, in salt water, in brackish water. Cholera bacteria thrive in this kind of situation. The cholera bacteria get themselves attached to sea crabs or sea fishes or prawns and all that. So if we must consume seafood at this point in time, we need to cook them thoroughly. And any type of meat at all, any type of food at all we're going to consume at this time, they must be cooked thoroughly. If we have cooked the food and kept it somewhere, we should warm them and ensure that the food is warm. And we consume the food when it is warm. And when we want to leave our food unattended, we must ensure that we cover the food properly. Vegetables, we must wash them. Fruits, we must wash them thoroughly before we eat them. So seafoods are safe to eat only when they are cooked thoroughly at this point in time. Seafoods are only safe for us to consume at this point in time only when they are cooked thoroughly. Once they are cooked thoroughly, the bacteria dies. The heat is sufficient enough to kill the bacteria once the food items are cooked thoroughly.
Okay, Doctor, stay on the line. We'll get back to you in a bit. Just to let you know that we also have Nigeria Info correspondent Precious Nena Okon joining us via Zoom, and I don't know why she's looking like she's hungry. Nena, are you hungry? Nena is joining us via Zoom. Nena was at Alausa earlier today, where, of course, there was a press conference by the Lagos state government to talk about, cholera and the issues we've had. Nena, please give us an insight as to what were the major points from the Lagos State Commissioner for Health about how the state plans to, going forward, tackle this menace of cholera.
Good evening, Lagos. Can you hear me?
Yes, perfectly.
Okay, so I was at the press briefing in Lagos where we had the Commissioner for Health in Lagos State, that's Professor Akin Abayomi. We also had the Commissioner for Education, for basic education, basic and secondary education. And basically, what the Lagos State government did was they were assuring Lagosians they are on top of the incident, they're on top of the outbreak of the of cholera in Lagos State. They are putting in place measures to ensure that it doesn't go beyond this. For the schools in Lagos, the commissioner said that they have these, they've put in place measures where students are able to wash their hands. They also have sanitizers for the students, and then the teachers are also made to go through some kind of training so that they are able to understand and able to report when they suspect any case of cholera. Basically, that was what the conversation was about today.
Okay, so of course, the Lagos State Commissioner for Health, Professor Akin Abayomi, looking at a situation where himself and of course his counterpart in the Ministry of Education, looking at ways to combat this issue from the schools, starting to teach these children, to do things the right way. Dr. Jaffet complained about how, well, he apologized, but, I'm not sure apologies. We have to say it the way it is. Quite a number of us Nigerians, I'm adding myself into the mix. We are quite dirty with a capital D. We go to the toilet. We don't wash our hands afterwards. We go to public toilets where the water is provided. This one is not the ones that there's no water. Water is provided. We can't do the simple basic thing of flushing the toilet. We just have that very terrible sanitary what's it called now? Sorry, my English fails me at this point in time. But you get what I mean. And to a large extent, all of these, have contributed to the issues we have now where almost 30 persons are dead. Dr. Jaffet, you heard, my colleague, Nena Okon, talk about how the government is, taking this issue to the schools to teach them, teach their teachers on how they need to be proactive in terms of being clean, because that's one way, like you said, of combating this outbreak. That's the way to go, right?
Yeah, that's the way to go. There are steps in response to concerns that we raised sometime last week, because we knew that when children resume when clinics resume from the holiday and they go into schools, we don't want our children coming down with diarrhea and cholera and then passing away from that. That would be really very devastating. And so the Commissioner for Health and the SC on Health, I believe that they started making moves to, I think the initial plan was to get the students off school or off the school. But I understand that there are plans to ensure that they are safe in school, so that may not be necessary. So I guess that's the reason why they are pushing those measures in place to ensure that the pupils are safe. Nobody wants to hear that their children going to school and, the unthinkable happen. So it's a very good move.
Okay, thank you very much, Doctor. By the way, just in case you do not know, this segment of the show is brought to you by the Lagos State Government. But of course, our major topic and of course our topic for the segment of the newsroom sponsored by the Lagos State Government is one and the same. We're talking cholera and we're talking about how we can avoid or reduce the mortality rates that we've had, 29 persons at least dying. Well, let's hear from the Commissioner for Health, Professor Akin Abayomi, who was, of course, speaking today in that presser. Let's hear from him. Take a listen.
One of the main principles of curbing the spread of a dangerous pathogen is to offer treatment absolutely free of charge of any suspected case in our government hospitals. That makes sure that we can attract patients to our facilities without them worrying that they have to pay. It allows us to remove from community patients who are infected Thereby, we're able to slow down the transmission and bring an end to an outbreak. Apart from that, we do not just wait for patients to come to our facilities. We go out and actively search for them. If you present yourself to hospital, it is likely that you have been in contact with members of your family, friends, and colleagues at work, and therefore we trace each and every one of the persons that have been in contact with you to identify if they have actually contracted the pathogen. In this case, cholera is a contagious, waterborne, foodborne contact bacteria. So it is easily spread if you have the pathogen on your hands, or you've been in contact with somebody that has it, or you've consumed food or water that contains the pathogen. The next slide demonstrates the typical features and symptoms of cholera. The topmost symptoms are profuse diarrhea and unretractable vomiting. The diarrhea is so profuse that it becomes almost colorless, and you're just passing watery, very watery stools. At the same time, most patients, it is accompanied by vomiting. So you actually cannot help yourself. You will be dehydrating from diarrhea, and you're not able to rehydrate by mouth. And that is what makes cholera so dangerous. Not everybody has vomiting, and in such cases, oral rehydration therapy may ameliorate your symptoms until you can reach a medical facility. Of course, with active dehydration, you become very unwell, you become fatigued, you may or may not have fever. Of course, with the diarrhea, you have severe abdominal cramps. And if you dehydrate very quickly, then you will be in a state of collapse. With oral rehydration therapy, it gives us a little bit of respite before you can present yourself to hospital. Oral rehydration therapy is available in all pharmacies. You can actually make it yourself with clean water, a little bit of sugar, and a little bit of salt, according to a fixed formula that is available online. And it is advised that if you start to develop symptoms of diarrhea and vomiting, that you start treating yourself with oral rehydration therapy, either that you make yourself or that you buy in a pharmacy before you present yourself to our medical facilities. As a public, you must be aware to support government by ensuring your own safety.
That was, of course, Professor Akin Abayomi, the Honorable Commissioner for Health right here in Lagos State. Dr. Japheth, you're still here, right? You can still hear us.
Yes, I'm here.
So, I heard.
But you had been here before.
Okay, apologies for that. But let me just bring you in on the last part of what Professor Abayomi talked about. You know, he talked about oral rehydration, you know, how you can start that yourself, first of all, before presenting yourself to a medical practitioner or go to maybe the hospital or a clinic nearby. Could you also tell Lagosians, you know, explain further how the average person who may be seeing symptoms of cholera, what they need to do, at least on their own, first of all, before you know, they can present themselves to medical professionals as quickly as possible. Time not on our side.
Yeah, the good thing about cholera is that almost everybody can treat cholera, especially when it's not severe. Because once you start seeing stooling and vomiting, that's part of loose stool, you should know that the individual is having symptoms of something similar to cholera. And then they can replace the fluids that the individual is using by taking that oral rehydration solution, ORS. And you can make it at home. All you need to do is just boil water. And once you boil the water, filter it and put water into a 1 liter bottle. 1 liter bottle. If you can't have a full 1 liter, just get 2 bottles. Put 1 spoonful of salt and 5 spoonful of sugar. Once you do that very, very well, and you can be taking it. The individual can be taking it as much as possible. I think you are just taking water. Because that is what will replenish the strength and the fluid that the individual has been losing through vomiting and stooling. And then, of course, you can proceed to the nearest health facility for further checkup and adequate treatment.
Okay, excellent. Hopefully, we'll be able to do that. I don't want to get into that story about tiger nut or no tiger nut because, of course, the Lagos State government has come out and denied that story. And, I talked about the fact that investigations are still ongoing. And as soon as it is concluded, we will hear how it all came about. But the bottom line is, we get this cholera from unsafe water, from using water that has been affected by poo, to cook, or we cook things that have, come in contact with poo as a result of course, like you said, the flooding we're experiencing at this point in time, and the fact that unfortunately we're in a third world, suffering third world issues. We do not have proper sewages. We do not have proper, water. And of course, this is causing all of the issues we now have at this point in time. Before you go, Doctor, what would be your advice to the Lagos State government? Already is as proactive as possible. They're already, doing what needs to be done. But what else would you want to see to ensure that we reduce the number of deaths we have currently had in Lagos State? In 1 minute.
I think everybody should be washing their hands. If we all can wash our hands, whatever happens, we are going to get rid of the bacteria. We should wash our hands, wash vegetables and fruits, cook our food very well, and ensure that we dispose of feces as much as possible in a very sanitary way. No more putting outside or inside plastic bags and throwing them. We throw plastic bags, continue to outside, the rain washes back into our homes. So if we want to stop this cholera outbreak or even the spread of this cholera, we should continue to wash our hands, observe good sanitary practices. And of course, for the long term, government should provide potable water for the
Thank you very much, Dr. Japhet Olugbogi, for joining us on the newsroom this evening. Did you hear me, Doc?
Thank you for having me.
All right, thank you very much. That was, of course, Dr. Japhet. He is a public health specialist and the medical officer of health at Ifelodun LCD. And, of course, my colleague, Precious Nnenna Okon, who's enjoying herself somewhere, but of course had the stress of covering Professor Akin Abayomi earlier today at the press conference. Precious, thank you very much for joining us too.
Thank you.
Okay, I thought you were not going to greet us. Anyway, you heard from Dr. Japhet. We should wash our hands. So if I, for someone like me, if I was not doing it as much as I should, since 2020 when we had the outbreak of COVID, it's 4 years after. Every time I go out and I come into the house, the first thing I do is go wash my hands. Every single time. It's now become a habit such that if I don't, I feel uncomfortable. Just the same way you feel uncomfortable when you're in the car and you don't wear seat belts. For those of us that wear seat belts, not for those of you that don't, that think it's a problem. The same way you feel uncomfortable about that is the same way you should feel uncomfortable when you don't wash your hands. Lagos, it's been the production of the newsroom. Kudos to my producer, Emmanuel Onwoka, who's done an amazing job today. And of course, the co-producer, Precious Nnenna Okon, who produced from Alausa today. Take care, people. I'll be back again next week, Monday. No, I think next week, Monday, there's going to be football coverage. So we will not have the newsroom next week. But in 2 weeks' time, I'll be here. Take care.
More conversation, more talk, more right after this.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.